Hey, frontline protectors of our tiniest patients! When labor starts too soon, it's not just early, it's urgent. Today we're talking about preterm labor, what it is, how to spot it, and how nurses can play a vital role in preventing premature birth and improving outcomes. Preterm labor is defined as regular uterine contractions that result in cervical changes occurring before 37 weeks of gestation. It's one of the leading causes of neonatal morbidity and mortality, and catching it early can make all the difference. So, some of the key risk factors are history of preterm birth, multiple gestation, uterine abnormalities or cervical insufficiency, infections like urinary tract infection or bacterial vaginosis, smoking, substance use, or high stress, and honestly, low socioeconomic status and poor prenatal care. The main signs and diagnostic criteria include regular contractions like every 10 minutes or even more often, pelvic pressure, low back pain, abdominal cramping, vaginal spotting or a change in discharge, and cervical dilation or effacement on exam. So, to diagnose preterm labor, we use a few key tools. Tocodynamometry is used to monitor contractions. Then, a speculum exam and measuring cervical length with a transvaginal ultrasound help us assess what's happening. Fetal fibronectin testing is another important step. It's a biomarker that can tell us about the risk for preterm delivery. And of course, we always do a urinalysis and cultures to check for any infections. When it comes to medical management, the goal is to stabilize the patient and prevent preterm birth if possible. This involves a combination of medications and careful monitoring. So yeah, it's a pretty comprehensive approach. Tocolytics are medications that we use to suppress uterine contractions. They're really meant for short-term use, usually to delay labor for about 48 hours. Some common tocolytics include nifedipine, which is a calcium channel blocker, indomethacin, an NSAID that's used short-term and only if the pregnancy is less than 32 weeks, and terbutaline, a beta agonist, but it's used pretty sparingly due to potential side effects. Alright, so let's talk about corticosteroids. Betamethasone or dexamethasone are given to help speed up fetal lung maturity and, reduce the risk of neonatal complications. Next up is magnesium sulfate. It's used for neuroprotection, especially if delivery is likely to happen before 32 weeks. Antibiotics may be started if an infection is suspected as the trigger, and hydration and bed rest are considered too, but these are really tailored to the patient's specific condition. So let's talk about nursing interventions and patient support. As nurses, our role is to provide both clinical care and emotional support to patients and their families throughout labor and delivery. Next up, we need to monitor uterine activity and fetal well-being. This means we'll use external fetal monitoring, often called EFM, to keep an eye on things. We'll track contraction frequency, fetal heart rate, and variability to make sure both mom and baby are doing well. Alright, so it's important to administer medications exactly as ordered. Make sure to monitor for side effects of tocolytics like hypotension or tachycardia. And don't forget to time those corticosteroid doses precisely. Providing emotional support is really key here. Anxiety and uncertainty are totally common, so validate those fears and take time to explain procedures. And, of course, involve partners or family in any care discussions. Patient education is a must. Teach about activity restriction, pelvic rest, and, the importance of hydration. Emphasize how to recognize early signs like contractions, back pain, or pressure. And be sure that follow-up plans are understood and easy to access. Preterm labor demands quick action and, honestly, compassionate care. Nurses are the frontline defenders of fetal health, maternal reassurance, and safe delivery outcomes. So, have you helped manage a case of preterm labor? Go ahead and share your best intervention or patient tip in the comments. And don't forget to like, subscribe, and follow for more OB nursing spotlights. Because sometimes, early care is everything.